Hello, I am Chet Tucker with the South Carolina Alliance of YMCAs, and I'm joined by Haley Patterson, who's our Community Health Director for the South Carolina Alliance of YMCAs. And we both are excited to tell you a little bit about the Partners in Prevention program that we're doing along with South Carolina DHEC, and we're excited that you've decided to join us today. Quickly tell you a little bit about what we are doing in partnership with South Carolina DHEC. We are participating in the 1817 Innovation Grant. It's a partnership between the South Carolina YMCAs and the Department of Health and Environmental Control. The design of it is to use innovative techniques to provide more positive outcomes for South Carolinians in their healthcare. Through this grant, we're using telehealth, different means, text messaging, referrals, bi-directional communication between healthcare providers and community health partners. We are currently beginning year 3 of a 5-year grant, and we are just about to start implementing this program via telehealth in South Carolina. I'll turn it over to you, Haley, if you want to tell them a little bit more.
Sure. Thank you for that introduction. And as Chet had mentioned, we're going to talk a little bit about the Partners in Prevention and how we can work together to be that. And we're going to talk about how we're trying to approach this as a team. And so I'll go ahead and give you the learning objectives for today so that you can know what's coming up. We do have, we're going to talk about the partnerships that we do have with DHEC, and then also that we would love to form with you and you, the people in the community. And then we'd like to talk about addressing the silent killer, hypertension. We would love to explain the history of the YMCA's blood pressure self-monitoring, how it came about and how it's evolved over the years. We want to tell you more about how the program works itself and how it could benefit a hypertension patient that you may be seeing. We want to help you learn how we can partner on this initiative and how we can identify if a patient is ready to participate in this program, especially if they are ready to participate virtually. And then we will help you, again, understand that referral process and talk about the bi-directional referral components that we would love to be involved with you. So again, we're going to talk a little bit about a team-based care plan and why that's important. So we have, again, like Chet mentioned, we have a partnership with the South Carolina DHEC in order to increase the use of telehealth, bi-directional communication, and referrals. So DHEC's, their goal out of this partnership is to, of course, improve heart health. And we want to do that through the use of telehealth. DHEC would love to identify healthcare teams to partner with South Carolina Alliance of YMCAs to offer this blood pressure program. So that's why you're reviewing this recording, because they have identified you as being a healthcare team that would be interested in partnering with us. They are trying to reduce barriers to participation in heart health programs. And so the YMCA is just one of those programs that is an option for your people, your patients. And DHEC's another objective is to improve that bi-directional referral process. And we're going to dig deep into that and what that means later on in the presentation. From our standpoint, from the South Carolina Alliance of YMCAs, we're hoping to increase the offering of the blood pressure self-monitoring program in order to reduce the risk of cardiovascular disease statewide. As many of us know, it's the #1 killer in our nation for both men and women. So we're hoping to reduce those numbers. We want to work with healthcare professional teams in order to effectively enroll patients into lifestyle change interventions and increase access to programs through telehealth innovation. So the healthcare provider team, that's you. So what we're hoping to get you excited about is to help us identify and enroll eligible participants, because you're the one who sees the patient. You're the one that's in the community that sees the people that might be struggling with their blood pressure. So you would, after this webinar, you would understand how to enroll eligible participants. And then you'll also understand what deems a person ready for a program like this. What we're hoping to do as well, we'll talk about this more in depth later, is to get you guys to actually provide the program materials to the patient. So we'll send those to you guys so that you can easily hand them over to them. So there's not a lot of running around trying to track down these things. And there are actually hand-on materials for these people to use. And then one thing that's going to be beneficial is that you'll be able to check in on your patients throughout the program to track their progress. As mentioned earlier, we're going to talk about the silent killer just a little bit, and I'm sure you're aware of these numbers, but it's just a review that 1 in 3 adults have high blood pressure. 1 in 4 of those adults have it under control. So we have a lot of work to do here. High blood pressure increases one's risk for cardiovascular disease, which I mentioned is the #1 cause of death in the United States. So one thing that is super important that the CDC has even identified, if you can see here at the bottom in this quote, that they recommend using a team-based care plan for their patients in order for them to be more effective in their lifestyle change and to better their numbers and to better their health. So that's why we're really here today, is to talk about how we can be that team-based care plan. And another thing I wanted to go back, I'm sorry, limited time with patients. So as you know, probably you only have 10 to 15 minutes usually with a patient. So you have that limited time to talk to them about lifestyle intervention. So that's another reason why it's a great opportunity to get your patient the help they need. We're there to bridge that gap. So to be there to hold their hand, give that doctors or nurses advice to help them bridge that gap so they can actually take the nurse's advice and start practicing the things that they need to practice to better their health. So what I'd love to tell you more about to help you understand why this program is a great program is the evidence-based piece of it. So we'll talk a little bit about the foundation of it, excuse me, and where it came from. Excuse me. So the program itself, it came from the Check It, Change It program. And it was the YMCA of the USA. They have a model where they identify a program that is a community-based program that seems effective, that has been shown to be effective to work for that special population. And then they take that program and they say, okay, how can we apply it with our YMCA core values instilled in them? And so Check It, Change It was the program that we saw that was conducted by the American Heart Association that said basically, if a patient monitors their blood pressure on a regular basis at home and they start tracking their nutritional habits, and if they have support from a Healthy Heart Ambassador or a community worker, they will have more than likely a reduction in their blood pressure or a better management of their blood pressure. And so this all came about because of the Million Hearts Initiative, and that is to reduce 1 million heart attacks by the year of, I think it was 2010, and then they extended it to 2020. So this is all a big collaborative effort to reduce the risk of cardiovascular disease. And so, like I was saying, this is the evidence-based health intervention continuum that you see on the screen right here that the YMCA of the USA established in order for us to onboard evidence-based, we call them also chronic disease prevention programs. And so we make sure that it's the efficacy is there, the validation is there. And then one thing the YMCA of the USA does is support the Ys in order to implement these programs. So they translate it to make it realistic for the YMCA to implement. And then they spell it out to multiple YMCAs after piloting in a couple of Ys to figure out what works best. And so the blood pressure self-monitoring program is in the scaling to dissemination phase, as you'll see next. So here is a list of the different evidence-based programs that we do have. Just note that the one in red down at the bottom is the blood pressure self-monitoring program. So again, it's scaling, working on disseminating. Some other programs that we do have that are evidence-based are like the YMCA's Diabetes Prevention Program, which is part of the National DPP program. Enhanced fitness, arthritis, self-management is what that one's for. Then we have falls prevention. So we have quite a bit of evidence-based health interventions that we do provide, but the biggest thing we're here to focus on today is for the blood pressure self-monitoring program. So let's talk about what is the YMCA's blood pressure self-monitoring program. So here's some key factors about this program. This program is there to help the patient track their treatment. So to really identify what's happening outside of the clinic. Another point down at the bottom, it says if We're checking to see if their blood pressure differs from if it's from the office versus at home. So sometimes people get high blood pressure, higher blood pressure when they go to the doctors because they're nervous. So this is going to help track that treatment too, the medications, the lifestyle factors that might be affecting their blood pressure. It's going to encourage self-control with their diet, physical activity, and proper use of medication. And most importantly, for a lot of us, cut healthcare costs. And that's just a little overview. So let's talk about who qualifies for the program. And this piece is very important because it's very specific on who can be enrolled in the program. They have to be an adult, so 18 years or older, be diagnosed with high blood pressure and or on antihypertensive medication. They cannot have experienced a cardiac event within the past year. So that recent means within a year. They cannot have an atrial fibrillation or other arrhythmias and not be at risk for lymphedema, which is caused usually from cancer or anything like that. And then a YMCA membership is not required, and this is going to be virtual, this offering, if a YMCA location is not nearby. And so membership is not required. In partnership with DHEC, though, we are asking that you guys refer those that have high blood pressure and high blood cholesterol. And those are just going to help us continue to fulfill the grant through the CDC, the DHEC and CDC, in order to serve those that have both high blood pressure and high blood cholesterol. So what is included in the program? It's 16 weeks, so 4 months of the YMCA's blood pressure self-monitoring program. They, the patient themselves, they would meet with a Healthy Heart ambassador, which is like a lifestyle coach, basically, that they meet with them one-on-one at least 2 times per month. And that check-in is normally about 10 to 15 minutes at a time. Also, outside of that, the Healthy Heart ambassador will do frequent check-ins with the patient to discuss their tracking of their blood pressure, tracking and management of it, and then asking them about their nutritional habits if they've applied some of the nutritional education components to their lifestyle yet. So they do have to come to a 1-hour group-based nutrition education class per month. So 1 class per month of nutrition education. Again, that's an hour long. And this is going to be held virtual as well, so that hopefully it's convenient that they can make it to that time and they can do it from their home. They could do it on the road if they're not driving somewhere, of course, but they could do it at their convenience and hopefully still be out and about doing whatever they need to do to get done. So it's not as big of a burden of having to come in and do the program. The blood pressure cuff is included in the program if the participant needs it. And then they are provided a notebook with tracking materials and program education materials. So it's going to be a packet of about anywhere from 50 to 70 pages of information. And it is a program that is the sources come from the American Heart Association, the CDC, the National Health Institute, and things like that. So what is required for the patient? We really need to make sure that there's a commitment to participate in the program on a regular basis for 4 months. And again, if you counted it, it's basically 3 encounters that they have to go through. Excuse me. 3 encounters. So meetings twice a month for 10 minutes with the Healthy Heart ambassador, and then 1 hour once a month for the nutrition education component. And so another commitment that we really need them to be focused on is measuring their blood pressure at home. And that's why we provide a blood pressure cuff if it's needed, if they don't have one at home that works properly. So those are the biggest things, is that commitment to measuring and participating. Also, one thing that is going to be something they have to work on is willing to participate or to work with a YMCA staff member whenever technical difficulties arise, because all of us know that technology can and will fail at times. And so we will have to work with them through those processes of trying to troubleshoot if for some reason the virtual help, the check-in with the Healthy Heart ambassador is just not working properly. So you got to be willing to do those things. And so I've talked a little bit about this already, those virtual expectations. So one thing that is going to be required is a camera phone, computer, or tablet. So Zoom is easily accessed, Google Meetings, anything like that. So any kind of web conferencing is used through a phone pretty easily. A computer or tablet is also something that can be used to do this program. Basically, they'll need to be able to utilize the camera so that the Healthy Heart Ambassador can see the patient taking their blood pressure properly. The proper techniques of measuring their blood pressure is one thing that we really do educate them on. So we need to be able to see that through that virtual offering. If having that camera, phone, computer, or tablet is not an option for the patient, we are willing to work with them and get them the care they need or the assistance they need in order to participate virtually. And so the check-ins with the Healthy Heart Ambassador, the one-on-one check-ins, and the nutrition education will both be over the phone, computer, or tablet. And so they need to be able to access that. And then one thing that we are working on is to make sure that if for some reason the nutrition education classes do not work for their time, or the time that, if it doesn't fit in their schedule, we're gonna have a makeup option for those that can't make it, which would be a pre-recorded nutrition education class that they would have to take a quiz afterwards to get attendance for. So I talked about how we could deliver things to you guys like the program kit. So we would make sure that the patient's ready to go in the program before it starts. So we would send a program kit, which is included. It includes a participant notebook with all of the educational materials, a blood pressure cuff if needed, and it is a loaner. So they get the blood pressure cuff to themselves as long as they can complete the program, the 4-month program. If they do not complete the 4-month program, we do ask that we get that blood pressure cuff back, just so that we have some incentive for them to continue to do the program. And so we don't lose all of our money on blood pressure cuffs. And then again, technology assistance is another thing that will be provided with the program. So you're wondering, how is this evidence-based? What do you do to make it evidence-based? So we track desired outcomes. We measure several different things. We measure their blood pressure. So we ask them to report their blood pressure that is taken at home. And we record their blood pressure whenever we do the one-on-one check-ins and the nutrition education. And we track those changes over the course of the 4 months. And then we track their attendance to office hours. We will track their attendance to nutrition education classes. And then we also track the text messaging aspect, which is part of that telehealth component where we are texting them, asking them, hey, how's it going? Are you able to check your blood pressure on a regular basis? How's the nutrition component coming? And then we track how many times we get those responses back from those people to really show the value of reaching out to them on a regular basis. And also tracking the program evaluation to see the effectiveness for them in quantitative and qualitative measures. And so here is a picture of our state with all the different YMCAs that do currently offer the blood pressure self-monitoring program. And if your state or your county is not here, that's okay. That's why we're going virtual. We are going to be able to offer this to people that are not in the counties highlighted. But just make a note of the counties that are highlighted and just know that if it's doable, there is a in-person option as well as virtual. All right, so we talked about the program logistics, about like what it is. So let's talk about if you're interested in partnering with us on this initiative, try to get your patients healthier, what you would need to do in order to get them enrolled into this program. So that referral process, and then we'll talk a little bit about the bi-directional piece. So option 1 is the most desired option. We in this option for referring, we want to ensure that the participant is ready or the patient is ready for the program and that the paperwork is completed prior to sending over a fax or email, whatever it may be, for their referral, okay? So this is going to be a little bit more time consuming, but it is, again, most desired because then we really know if this person's ready to be in the program before they even get to us at the YMCA. So we want to identify eligible patients with both high blood pressure and high blood cholesterol. We will show you how to complete a readiness assessment that we have created. We'll provide all those forms to you. and then complete all enrollment forms, including like a HIPAA authorization and informed consent form. So here's an example of what it would take to enroll a person into the YMCA's blood pressure self-monitoring program on your end. And so you would identify that person with hypertension, discuss the program with them, and then we have a video that was created through DHEC and AHEC and Dr. Lackland from MUSC. So there's that video that a patient could watch and understand a little bit more about the program. And then you would determine the patient's eligibility through the enrollment form. There's a checkoff to say like, yes, they have high blood pressure. No, they don't have an atrial fibrillation, stuff like that. Then you would complete a readiness form, which I'm going to show you in depth what that is here in a minute, just to make sure the patient's really ready for this program so that we can get the desired outcomes we're intended to do. And then complete all enrollment paperwork, collect program fees if applicable. And at this time, the program is free to patients on the behalf of DHEC, and provide a program schedule so that they can know what kind of class is available, what kind of offerings that we do have, and to let them know that we are flexible, that we can work with them if that program schedule does not work for them. You would provide the participant or patient with program supplies such as the blood pressure cuff, the notebook, and the internet accessibility tools. Then you would have faxed that referral to the South Carolina Alliance email or fax number, and enter the patient info into our secured shared form. So what we're planning on doing is having a platform where that we can communicate with you guys through your system, whatever works better for you guys. So we're just going to figure out that piece one-on-one with each practice as well, because we do want to have regular communication with you guys. So we're hoping we can use this data collection software system in order to communicate with you guys. And then also expect to receive some feedback from us. Like I mentioned, like you will get patient progress updates frequently. And so as I had mentioned in that workflow, the enrollment checklist, here's an overview to help you check it off, make sure you got each piece completed as you're getting ready to refer a patient. Here's the readiness assessment to do a virtual YMCA's blood pressure self-monitoring program. So these are the different things you want to make sure that they're willing to do based off their behavior change and the things that they're ready to change. And just make some notes about if a patient is having any hesitations about doing this program or anything like that. And here's the enrollment form I was talking about that has all the checkoffs. So the things that the data that we're collecting here, and then also making sure that they're eligible for the program. Here is the authorization and consent form, and this is like a HIPAA form. So they have to put their name, contact information, the date of birth, and all that stuff. One thing that they do have to make sure that they complete is the piece where we can share information with the healthcare provider. So make sure they sign off on that, and then you're eligible to send all those forms to us and consent that information to us. So that was a very lengthy process. But again, it's going to ensure the effectiveness of the program because it is virtual. We can't get them to sign those papers easily to us. So it's going to be easiest if they do it in the office where they're used to going, where they're comfortable being. So option 2 would just be to send eligible patients our way. So just refer them over by completing a referral form and just faxing that or emailing that over to us or through our secured platform that we're hoping to use soon. And then also completing authorization forms just so that they can have those completed to be in the program. So here's an example of the referral form. And then again, that authorization form that we've already seen. And as I mentioned earlier, there's some helpful videos to share with your clients, your patients. So we have the blood pressure self-monitoring overview video for patients. And then we have another video that's very similar to this that talks a healthcare provider through the referral process. And I am going to turn it over to my colleague, Chet, to let him talk a little bit more about that hypertension team and what it really means to be that hypertension team and what you can expect from us.
Well, so as we discussed, really kind of the best results are driven when there is a team in place. whoever that may be. In this case, it would be the CDC who is funding the grant through DHEC, who is facilitating and managing that grant. The YMCA is the grantee. We're actually putting the effort on the ground into place, and then we're working with healthcare providers. So that group of organizations coming together is what's going to make this so successful. So we've mentioned that bidirectional communication piece, and that's one of the things that's most important here. The idea of this is not for healthcare providers just to turn over the patients to us and be done with it. Really, what we're trying to show through this grant is that when we all work together, we're able to improve those health outcomes. So as we get that information from you, those referrals of the patients, we're able to work with the patient, be the kind of lifestyle coach for them, help them understand how they are able to impact their blood pressure, what changes in their lifestyle can have an impact on it, either taking their blood pressure up or down or anywhere in between. And then sharing those results back with their healthcare provider so that you can take advantage of that and see what's really going on in between your visits. And we do that through progress letters showing you their results and kind of helping you know, did this person really attempt to make progress? And if they really were trying and either it went up or down, we can help you come up with a plan to how to have that better health income or health outcome. And so really through the collective group, we're able to take those results. We'll share that not only with the healthcare provider, but also with DHEC. DHEC will then kind of take all of that information from all of our sites around the state and all of our patients going through and collect that data and then share that back with the CDC. And the CDC, through all of the different programs that they have going on, will be able to determine how future funding is allocated, be able to share their data with multiple other organizations who are looking to implement either similar programs or take the pieces of each program from across the country, figure out what works best and combine them all together. So the overall impact and the goal is those increased health outcomes, not only for South Carolinians, but for people all over the United States. We put together the fact sheets that kind of show, what is going on across South Carolina, where the programs are being implemented are having an effect in the community, how many participants have participated in the course, how many people have completed it, and what kind of their overall change in health outcomes was. And so finally, we talked at the beginning kind of about the collaborations, but it's a partnership between the CDC, DHEC, the YMCA, and community health workers and patient navigators like yourself, kind of throughout the network, that will really make this collaboration work and be successful and provide tremendous outcomes for South Carolinians. And we thank you for your consideration. If you've got any more questions, you can certainly reach out to either Haley or myself or any of our partners at DHEC, and certainly be able to share more information with you and kind of talk individually about how this program may work within your organization. Haley and I both thank you for your participation. And again, please don't hesitate to ask if you need any more information.
Thank you.